So I just squirted some of the blaster oil into my hands. I tend to use it pretty generously. You want to make sure that you don't have a lot of friction when you're working. It smells amazing. It smells like a day at the beach. So I'm just going to make sure that it's covering all the area that I'm going to be working. It does tend to leave your hands pretty oily, so having a towel nearby is helpful. Just so you can dry off your hands before you use the Fascia Blaster. This one tends to have really good, you can kind of manage it without slipping out of your hands, but it's still good to kind of dry that off. So when I'm first starting, I'm really just kind of like barely, not quite this light, holding it on, but I'm not putting a lot of pressure downward. I'm just kind of letting the Fascia Blaster kind of let the client get comfortable with it, kind of warming up the tissue. And so when you're working on yourself with the Fascia Blaster, you can move your body all different ways. When you're working on a client, you just have to communicate a little bit more about moving. And so with leg work, I usually like to ask clients to bring your legs as far apart as possible, just straight, bring your legs straight. That way I'm not banging the edge of the tool into their other leg or into any other body parts. And so you kind of want to be mindful of body contact, but sometimes your body can be helpful. Like I've got my body pressed against this leg just so that the leg's not rocking so much, so I can press my body against her leg here. You just want to be mindful too, if you've already put lotion or oil on that part of the body, it's touching your skin now or your clothes. So you can go up and down motions, you can do circular motions, and you should do a variety of motions. So if you've got circular motions, you can go straight, back and forth and up and down. And these little prongs are going to be kind of warming up the tissue, getting into the top layers of the fascia, not super deep. And you can still, you don't want to be using so much pressure that you're, causing any pain, especially around bony prominences, joints, and attachment points. Usually, you can work pretty close to, like the knee, for example, but you probably wouldn't want to go over the joint with these. If you want to do more specific work around a joint, you can use a smaller tool. You really could use either of these. It's just a matter of where you're at. So if you're just starting, you want to warm up with the smaller prongs, and you can kind of work pretty quickly and briskly around joints where there's attachments. Obviously all joints have attachments. IT bands tend to be a really awesome thing to work on for fascia blasting. It can be one of the least uncomfortable ways to really work that out. And so I'm going to show you in a minute different positioning that I'll put the client in for fascia work, but I'm just kind of waking the tissue up a little bit here. But I try to really just work the tissues that are accessible in a given point. So if I'm, I've got her supine, so I'm going to work the very front of these muscles, but I am not afraid to use lots of different positions. So I'm going to have her prone, supine, and sideline, just so I can access and get a good pressure on the specific areas that I want to work. You can pause it.